We all want to get more done and be more productive. And so sometimes we sacrifice sleep in order to do that. What if I told you that sleeping more would actually help you get more done? What are we actually trying to do when we're studying or reading or trying to learn new things? We're trying to store that information in our brains to retrieve it later on. The hippocampus is a part of the brain that is critical for this process. Studies have shown that not getting enough sleep can impair your ability to form new memories in the hippocampus, and your hippocampus will actually shrink. Not only does sleep deprivation affect how you can store memories, but it also decreases your ability to focus. So now let's go over the 5 best sleep tips so you can fall asleep effortlessly every single night and feel well rested the next day. Number 1 is to obtain blue light blocking glasses. Blue light, which is the light waveform that shines through during the day with bright sun or maybe a really bright light bulb, is what signals to us that it's daytime and helps us stay awake. When it's time for us to go to sleep, the sun goes down and it starts looking orange. And when the sun goes down completely, it's dark. Really orange light or complete darkness will signal to us that it's nighttime and it's time to go to sleep. And our bodies will naturally produce melatonin. Melatonin is a neurotransmitter that helps us feel sleepy. Blue light blocking glasses help our bodies produce melatonin ourselves and therefore helps us feel sleepy.
I'll do it myself.
In fact, a 2021 literature review of 29 studies on blue light blocking glasses, 24 of which focused solely on sleep, noted there was substantial evidence for blue light blocking glasses being a successful intervention for reducing sleep onset latency in patients with sleep disorders, jet lag, or variable shift work schedules. Given the well-established biological mechanism and clinical research showing that blue light blocking glasses are effective for inducing sleep, they are a viable intervention to recommend to patients with insomnia or a delayed sleep phase. Insomnia meaning having difficulty falling asleep, and delayed sleep phase basically meaning you're staying up way too late. So if you're having a lot of trouble with sleep, try throwing on some blue light blocking glasses about 3 to 4 hours before bedtime. And once your sleep is doing better, you can try decreasing the hours you have them on before bedtime to about 2 hours. Any blue light blocking glasses will work. Make sure they block close to 100% of blue light. Check the description below for the glasses that I use. The next sleep tip is to turn off all the lights. Okay, so this is a similar concept to the blue light blocking glasses. So 3 to 4 hours before bed or 2 hours before bed, once your sleep starts doing better, you want to turn off all the lights in the house. You use candles instead to see things. If you absolutely can't see and you need some artificial light, get your phone, turn on the flashlight and point it away from yourself. But definitely don't turn on any overhead lights or any significantly bright lights, as this will immediately stop you from feeling sleepy. If you're going to look at screens before bed, which most of us do, make sure you're turning down the brightness of the screen as much as possible to where you can still see the screen, but it's not bright at all. This goes for your phone, TV, tablet, anything. Tip number 3, nothing entertaining before bed, ever. That means you don't watch videos in bed and you certainly do not have a TV in your room. You want to associate the bed with feeling sleepy and going to sleep. So acceptable things to do in bed are closing your eyes and going to sleep, or lying down with your blue light blocking glasses on and reading something like a textbook or practice test questions. Anything that's boring and is mentally fatiguing is fine. Again, make sure you turn down the screen brightness. It's a good idea to plan about 30 minutes to an hour of doing boring stuff in bed before you're going to feel sleepy enough to fall asleep. So if your bedtime is 11 p.m., plan on getting into bed around 10:20, 10:30 p.m. Tip 4 is using a noisemaker in your room to help you with your sleep. Noisemakers can help you with your sleep in several different ways. Number 1, you can start associating the sound that the noisemaker makes with feeling sleepy and going to bed. So definitely as soon as you wake up, make sure you turn that noisemaker off. Number 2 is the noisemaker can help you sleep more deeply because you won't be woken up by random noises that happen during the night. Maybe someone in your house is walking around, the cat's meowing, your neighbor saying something. The noisemaker will help block all of these out. For the last and final tip, I'm gonna give you a great supplement stack that is all natural and can help you with your sleep a ton. Magnesium is a relaxing electrolyte which activates GABA in the brain, which we talked about in the nicotine versus caffeine video. Here's a chart from the National Institute of Health with daily recommended values of magnesium so you can check out how much you might need per day. For example, if you're a man and your age is between 19 and 30 years old, your daily recommended value is 400 milligrams of magnesium daily. In this example, it would be a good idea to start with 100 to 200 milligrams before bed. The second supplement is melatonin. If you have trouble falling asleep, you can use the immediate release. If you have trouble staying asleep, use the extended release. Less is more with melatonin. I'd recommend start off with the lowest dose, which is 0.3 milligrams, and see how that works for you. Number 3 is glycine, which is one of the 20 amino acids. Basically, it's found in meats and proteins. 2 to 3 grams of glycine is normally what's recommended. And not only does it help you fall asleep and stay asleep better, but the next day it also helps you stay more alert and perform better on memory tests, likely due to getting better sleep. Now, I wouldn't start all of these right away. Start with one, give it a try, and see how it helps your sleep. And then adjust from there, and you can add one of the others if you feel you need it. There's a link in the description and in the comments of all the sleep supplements mentioned, so you can check that out. Of course, check with your doctor before taking any new supplements. We want better focus, we want better memory. Do you have trouble with attention and focus? And have you ever thought to yourself, do I have ADHD? This video right here will tell you all you need to know. I'll see you over there.